Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my very Jedi co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
It could be my high metachlorian count, Amy.
I think that's what it is.
Is there anyone listening to this that knows what a metachlorian count is? I know Nils does.
Based on the average age of the listener, I'd say yes.
No. They're mostly female. They have no idea what I'm talking about.
I know. But then again. So if you are listening to this episode and you've not read the title, this is not making sense. But we were talking about more dark sides of plastic surgery. We had an episode where we talked about the dark sides of plastic surgery kind of mid-end of 2023 that will be linked in the description box below. So if you want to hear us talk about some of the dark sides of plastic surgery, now we're going to talk about even more dark sides of plastic surgery. We welcome everyone who is a new listener to our podcast. If you have not subscribed, it's easy and it's free. You can subscribe. We won't send you anything. Just click that little bell for notifications and you'll get an episode update.
Your whole life would be better if you did that.
You could hear us twice a month.
Yeah.
So you can also follow us on all social media at Jason Martin MD and at Beauty and the Surgeon Podcast. And of course on YouTube at Jason Martin MD.
So the only question I have from the last episode, did we talk about Yoda? Frustration leads to anger, anger leads to hate, and goes to the dark side. Did we talk about that or no?
We talked about that in an episode recently, actually. I can't remember which one.
Which one was that, Nils?
I don't remember, but I remember I put Yoda up on the screen.
Yeah.
Please do that again.
Yes.
Yoda. Yes.
And we're going with the whole dark side theme.
Yes.
Yeah. So this episode came about because we got a comment on one of our YouTube videos from someone, which I do appreciate. Love comments. This one, though, kind of threw me for a loop, and it made me think, like, wow, like this is one of the dark sides of plastic surgery, is this kind of mentality. And no shade to this wonderful person, wonderful listener who left the message, and I will read it. But before we read it, let's talk about we're going to talk about three specific dark sides of plastic surgery. And those three things are decision-making, education, or the lack of education, or the TikTok education, or the Google education. And then number three is ego and ethics. And that is specifically on the doctor's side. So
can we just skip three?
Right. Oh, no, three is important. So these are the three things we're going to break down in a little more detail, and it'll make a little more sense once I read the comment from this listener. So the comment said, one can never blame the patient. The doctor has to be the judge and the decider. If they can do the procedure and if the patient can benefit from certain procedures, patients are very trusting of the doctor.
I have a really hard time with this quote.
Oh, I did too.
Okay.
And that's why,
I'm glad you feel the same way.
So it took me a while to respond to you. And I do apologize, listener, that it did take me so long to respond. It was more because I really wanted to be able to do an episode where we talk about how I feel about this. And it is true. Patients are very trusting of doctors. A good example of this is one day several years ago, Dr. Martin and I were in Starbucks and we had walked over to Whole Foods and I had him get a kombucha because he had complained that he had had some digestive upset. This was before Dr. Martin started his health journey. And we were, we were in our scrubs. We walked into Starbucks and the guy behind the counter says, oh, like you drink those? Like you're a doctor? And I'm like, I am literally a nutritional therapist. Like Dr. Martin knows nothing about this. Like he bought this because I told him to, but because he's a doctor, this guy thinks that he knows everything.
Listen, I live off that every day. Yeah.
And a lot of doctors do. And that's where the ego component that we'll talk about at the end, this is real. Like there are people who feel like this and tell their doctors things like this and feed into this ego. And then you wonder why someone tells us that they woke up from their breast augmentation with implants 3 times the size they wanted because they told the doctor or the doctor told them, I'll choose the implant for you. Mm-hmm. I know the implant that's best for you without any idea. And we do say that to patients from time to time, but we also say, I will say to them, I am ordering these size implants. Are you okay with any of these sizes? They're within 100 cc's of each other. We'll pick the final one that fits. But it's never like we just go in and like, a la carte surgery. We're going to just pick what we want. So this is the comment that we're going from.
Right. And the reason we started this podcast a long, long time ago, besides the fact that Nils thought you and I would be good on a podcast, and we didn't really even know what podcasts were 100 years ago when we started this podcast. But the reason we started this podcast was education and empowerment.
Which I do talk about in one of our slides.
Yeah. And so, this quote, albeit we understand where this listener is coming from, is really highlighting the issues Amy and I both saw in surgery even before we started doing this podcast. If you go look at every episode, pretty much we've done besides personal ones that we're interested in, It's about education. It's about empowerment. So you don't go into an office.
Even those are about education.
Right. And look at a doctor and say, well, just do whatever you want.
Yeah,
like that to me just rips my heart out personally. I never want a patient to do that. No matter how scared they are, no matter how confused they are, I really, really want them to be part of the process.
Yeah. And like judge and decider, like that's dark.
Yeah.
That is some dark stuff. So let's break down now from this comment. We're going to talk about all three components, the education piece, the ethics, the empowerment. We'll get into all of this. So decision making.
We have to talk about the doctor ego part.
That's at the end. So decision making.
This feels like a therapy session or something.
Yeah.
All right.
Decision making. Your surgeon is not God. And this is a really interesting thing because in surgery, there is not usually a lot of data. However, there is a ton of actual scientific data, research, tons and tons about shared decision making and its improvements in outcomes in patient care.
Yep.
Like so much. This is hugely studied. And there are a lot of reasons why. So, Dr. Barnett, I mean, as the doctor, I mean, like talk about some of the reasons why shared decision making improves the patient experience.
Yeah. So just real quick, in the OR itself, because you brought that up, we do a timeout. And in that timeout before surgery is we have to detail everything we're doing, the actual surgery we're doing, and everyone
the right patient.
And everyone has to agree, including the anesthesiologist, circulating nurse, and the scrub tech. And that is a shared responsibility, and that's for patient safety. And that ethos of what we're doing there, which is a requirement now in all operating rooms, it should be shared also in the office itself, is that everyone has an understanding of what's going on. And it's not just informed consent, like going through the risk and benefits and what we're doing, but actually talking about the surgery itself so that you, the patient, has a full understanding of what's happening. I have my arms up again.
Yeah, you're
yeah.
Lipo now.
Yeah, lipo now. So the patient understands exactly what's going on, and they're also okay with the plan. And why that is important is Amy put on the slide, so you can watch on YouTube or see it on YouTube. It improves your knowledge regarding the options. So imagine you go in and you say, okay, the doctor is the decider. He's the judgment and deciding entity or power that. How would you? I can't even say it.
I know it goes against the grain to even say it.
It's uncomfortable. Yeah. So the idea of that is really saying, okay, we don't trust you enough to give you the information to help you decide. Yeah, and that is devastating in terms of what cosmetic surgery or aesthetic surgery is about, which is about empowerment, bettering yourself, and for you finding the path that's good for you. Decisional conflict. This is so important. We get patients that come in all the time, even they've gone to well-meaning doctors where they didn't feel like they were part of the decisions and regret things afterwards. Regret is one of the worst feelings you could ever have after an elective cosmetic procedure. And so the way you avoid that is
disappointment. I mean,
regret and disappointment go hand in hand usually. Yeah. Improving accurate risk perceptions of the possible benefits and harms, which is basically just informed consent.
It is, but people tend to think that elective surgery has no risks.
Yeah.
I mean, and we bust those myths a lot on our myth busting episodes.
Yeah.
You know, that because they're choosing to do it, that they aren't going to have bleeding or that they aren't going to have some other complication come up that is maybe even unrelated to the surgery they chose to have. So, you know, understanding that this surgery is not without risks and that there could be potential harm or lifelong changes in sensation. We talked about our blepharoplasty episode recently about blindness. You know, there are real risks with even elective procedures.
Right. And obviously with blepharoplasty, that's super rare that blindness could occur, but it is measurable. Mm-hmm. It's happened, and there's case studies on that. One of the things Amy put on here, which I really, really like, is talking about your values, right? So a surgeon doesn't know your values. If you just let them decide what implant they're putting in you, then that may not share the values you have for outcomes. If they put really large implants in and you have a small body and your values is that I don't like to show other people, I don't want to draw attention to myself, this is not my lifestyle. Maybe you like going to church and you don't want to draw attention to your chest.
Or you want your clothes to still fit you.
Exactly. Then clearly that's a problem. And again, we use the breast aug comparison or analogies because that's the easiest one for people to understand. Communication really is the key to all this stuff. And we try so hard in our office to allow a safe space for people to communicate. I'll tell patients all the time, like, you know, speak your piece. If I'm saying something you don't like, tell me. It doesn't hurt my feelings. I want you to question me. I want you to look at me and say, I don't understand this. I don't agree with what you're saying here. I don't like this picture. I don't like this after picture you're showing me. That's not what I want. These are really, really good discussions, and that all comes from communication. And if you go into an office and you think that the physician or the physician's office are the deciders of everything, then you're not going to be able to feel like you can communicate. Communication is two ways. It's not just one way. So I think communication is probably the most important part of this shared decision-making process. Mm-hmm. And if you go into an office and you don't feel like you can communicate, you need to leave. I don't care.
That's not your doctor.
I don't care how good they are or what you think the outcome's going to be, because you're ultimately not going to be happy. They're going to miss something that you wanted.
Well, that's not just with plastic surgery. That's with anything. And I think I see this a lot, in women who have breast cancer. It's such a scary thing that they get referred to one doctor and they just believe everything that one doctor tells them, and they think that that's their only option. And it sounds so scary that they're afraid to question anything, because then they also have this like ticking time bomb in their mind that like, oh my gosh, if I question this, it's going to delay it and then I'm going to die. And like, that's maybe taking it to a pretty extreme. But
that's such a good example.
Yeah. Like it's that fear.
Right. And by the way, with breast cancer treatment and surgery and chemotherapy and radiation, there is nuance there, right?
You have options.
It is important for you to understand what those options are, especially if you're in that gray area, which a lot of breast cancer patients are. Do you need radiation or not? Do you need chemotherapy or not? Taking the time, at least an extra day, to really sit down and understand it, and then communicating with your physicians, your clinical team is just so important. And people don't do that, especially when they're stressed out and nervous and they don't know. And the same can apply to cosmetic surgery. People come into our office like, oh my God, it's a doctor's office. The doctor is, especially my personality type, I'm more commanding. I walk into a room. I don't seem like things are bothering me. I'm just ready to go and I'm energetic. And that's great and all, because you can trust me and you think, okay, this guy's going to do a great job. But the part of it is, does that allow an open discussion, right? Is that a safe space for you to speak your truth and to ask the questions that are maybe really personal or hard? And I think it's so important that you go in with the mindset, I'm going to force myself to be the best version of me and ask as many questions as possible. And if something doesn't feel right, I don't care what it is. It doesn't even have to be about the surgery, the way they want to take your payment or whatever it is. You say something. You say it. I think that is the best approach to any kind of elective procedure.
Yeah, that's not just elective. This is just in medicine in general. Like, I think
in life too, but I'm not always good like this. Sometimes, like when I go, like, I know what the feeling, the feeling when you want to just get through something. You're like, okay, it's fine. I'll pay it, or I'll just do this and that.
Right. Yeah. But that's what I mean. This goes beyond a surgery you've chosen to have into any medicine at all, and that's really what I want to make sure that message gets across. Like, I'm not saying all these things specific to plastic surgery. Like, this theory that your doctor in any realm is going to be the sole decision maker of your health and your life is absolutely not true. So these things go to dentists, to your dermatologist, to any healthcare provider. You need to make sure that you're getting your questions answered. We, in all of our episodes where we deep dive any surgery, we actually have listed in there questions you should bring to your consultation, questions you should ask at your pre-op appointment. Like, get your questions answered. Absolutely. And that your doctor should want that communication. However, ego, we'll talk about ego at the end. So
Neil said we're skipping the ego part.
Yeah.
No.
So one of the other things that decision-making, the shared decision-making, it improves adherence and it also improves outcomes. So this is randomized trial data shows that better clinical outcomes in symptom control, quality of life, and depression come when there are these shared decision-making, which makes sense, right?
Because if you have buy-in and empowerment, you're more motivated.
Yes.
I mean, the health outcome for people with cosmetic surgery, it doesn't get rid of depression. It doesn't make you happier, but they have better health outcomes. Why is that? Because you invested in yourself. And therefore, you are going to put sunscreen on. You are going to go to the dermatologist. You may follow up with your primary care physician.
You're going to keep taking your blood pressure medication.
You actually are invested in the outcome. And so personal investment is a big part of health outcomes. It's probably the biggest thing of everything.
Yeah, adherence.
Besides education and access. So that kind of idea of being self-stimulated and having buy-in is so important.
Following your post-op instructions. One other thing that may not seem like it would correlate is lowered costs. So this was a report from the Commonwealth Fund, which is in the UK, and from 2008. But even back in 2008, they estimated that implementing these shared decision-making kind of strategies for 11 preference-sensitive procedures, which is things that like could go one way or the other, the savings to the national health spending would be approximately $3.8 billion over 5 years and $9.2 billion over 10 years. Now, of course, this was done over 10 years ago. So just those little things like where you actually include somebody in this decision making, like maybe they don't want this procedure that is preference sensitive, not life sensitive.
Right.
Right? Like you can be like, no, you know what, I'm good. Like, I don't need that. Or let's try this instead. Let's try an alternative treatment before we do this. Those things have real savings over time. So there is a benefit of involving your patients in these decisions that may lead to less invasive interventions.
So people that have back pain can have herniated disc and problems in their spine. And you can take that patient, look at an MRI, and you can immediately go to surgery just based on the MRI results and their clinical presentation. Or you can do some of these lesser invasive things. You can do steroid injections, go to a pain doctor. Physical therapy. You can do like exercises like, like yoga and all the other kind of stuff that's more stretching kind of exercises. And that's like a really good example of that whole distribution of options. And if you just have a person that comes in and you're seeing a surgeon, well, what does the surgeon want to do? I mean,
got a tool.
Yeah.
Wants to use it.
Right.
Yes.
So
surgery.
You being empowered in that situation and educated could say, oh, yeah, I'm going to try these alternative treatments first.
Yeah. All right. Let's take a quick break. We're going to come back and talk about education. All right. Where the dark side is starting to turn.
Yeah. It's more light.
Right. We're getting good clinical communication. Now we're going to talk about education.
We're feeling the force.
Yes. I put on this slide, not TikTok U, meaning TikTok University, or TikTok Confidence, which I call it TikTok Confidence, or Google Doctor. I mean, the amount of times that people will come in, or in cosmetic surgery, Real Self Confidence. Real Self is a kind of cosmetic surgery based platform. So people will do a lot of research by experts on TikTok and come in and think that they know everything. But that's not the kind of education that we're talking about. The kind of education that you want to get from your healthcare professional, not TikTok, is if, are you a candidate for surgery? And if you are or are not, if we won't ever just say to someone like, no, we wouldn't do that on you. We will say why. Yeah. Or we might say to someone like, you're really here for this, but you're also a candidate for this. And this is not us trying to upsell them. We're just trying to let them know that they have options.
I had a patient, just for example, and I think this is really emblematic of this, that she came in for eyelids. And I told her, I said, you would really benefit from your face and neck. Mm-hmm. And it's the words that are coming out of your mouth are not really good. The eyelids aren't going to do that. I'm not saying you have to do the face and neck lift, but what I'm hearing from you, it sounds more like a face and neck lift than the eyelids. And she was really appreciative of that.
Yeah. Or just where their money would be well spent.
Yeah. That's the other part of it. Yeah. That's such a good point too.
Yeah. If they have concerns about the cost of something, telling them where they're going to get the most bang for their buck, essentially, that is a place where you got to, kind of rely on the education and the expertise of the surgeon you're seeing. So does the surgeon you're seeing do the surgery you want? Or is he or she offering you something else because it's the only tool in the toolbox?
Oh, yes. Preach.
Mm-hmm. So this is where the TikTok U comes into play. People see the surgery on TikTok and they're like, oh, yeah, that's the one for me.
Deep plane facelift, ponytail facelift. Oh, I saw this. That's exactly what I want to do. Well, that's fine. Deep planes are great. I do them, ponytail, whatever. But it doesn't mean that that's what's right for you. And just because you saw that in a kind of marketing platform, which we participate in, so we're not against that kind of stuff, doesn't mean that that's applicable to you at all.
Right. But if you're going to a doctor that only does that, they're going to tell you it is.
And if they're not willing to say they don't do some things, then I have a problem with that too. We say that all the time. We say, oh, you can go here, you can go there, you can do, these are your options.
No, they're going to double down on why this procedure is better.
Yeah.
So if you ask questions about, well, what about this? They're going, no. This will fix you.
Yeah, dermatologists are notorious for this because they'll tell you, oh, you don't need a facelift. You can do all this filler. You can do this laser. You can do this RF treatments. Yeah, you can do these threading things.
Yeah, lifestyle lift.
And it doesn't work like the way they say it's going to work.
Well, it doesn't maybe work the way you in your mind you want a facelift, and they're going to tell you, oh, yeah, this is the same thing. This will give you the same thing. This is a liquid facelift. It's the same thing. So be cautious of someone trying to direct you to something that they do versus what you might actually need and or that they don't do. If they're dissuading you from seeking out an option that they don't do only because they don't do it.
But how does a patient know that, though? That's hard. That's a hard situation.
That's when you can ask.
Yeah.
I mean, like, do you have hospital privileges at a accredited facility? These are questions to ask your doctor, your board certified plastic surgeon. Are you a board certified plastic surgeon? This is a good way to find out.
Or, you could just say, let me see some of your before and after pictures of whatever thing you're interested in. Mm-hmm. And if they say, oh, I don't have any.
I don't do that. Yeah. They might say, I don't do that. Yeah. So this is an important thing to be very, very educated about. What about this one, Dr. Martin?
What are the risks? There are risks with any procedure, and we talk about this all the time. Sometimes patients don't even want to talk about it, and I just force them to.
Like, you're going to hear the risks. You don't have to talk about it, but you're going to hear it.
That's a big part of being an ethical physician that does procedures of any type. It doesn't have to be a plastic surgeon. If you don't talk to people in an informed way about what the risks are with a procedure, then that's 100% inappropriate. Mm-hmm. And it's just not medicine. It's not proper medicine.
You're not being educated.
No. Yeah, but it's not. You're not practicing medicine in a proper way if you do that.
Ethics.
So I mean, it's mandatory. That's a Hippocratic oath. You have to inform people exactly what they're getting into.
And sometimes the risks aren't scary. You know, I do a treatment for
most of them are not, to be honest with you. And you could, you could say, okay, risk of blindness, but if you look at the percentage of people that go blind with a blepharoplasty, it's so astronomically small, right? So you could make them understand what those statistical numbers actually are.
Yeah, anybody who's had to take a college level statistics class understands the fallacy of believing all statistics, right? Or what percentages really mean. You know, and a good example of something that we do in the office.
Are you saying that you don't believe in statistics?
I am going to tell this story. You interrupted me twice. I'm going to stop you right there, Dr. Martin.
Say statistics?
No, I am not. Okay. In fact, I don't even want to tell it anymore.
All right, go ahead.
I had a great story to tell about the duo.
What was you guys to tell? What was it?
We're talking about risks. So not all risks are scary. And I think that's where people might, get averse to hearing anything, going back to like the breast cancer example, like those risks are pretty intense and pretty scary. But let's say you're having the duo treatment for erectile dysfunction. I might tell you that one of the risks is redness or bruising. And you're like, oh gosh, I don't want to bruise on my penis. But again, that's not going to hurt you and it's going to go away. So risks are not always things to be afraid of. They're just risks.
Yeah.
They're not.
Bruising is a risk. Swelling is a risk.
Right.
That's pretty much inevitable.
Yeah. It's not the end of the world and it'll go away. Yeah. So it's not a life-altering risk. Something you should know, if there are alternative treatments, are you a better candidate for this alternative treatment? This is something we actually get a lot. People come in, they want to talk to us about FaceTite, right? They're 55. They want FaceTite.
Yeah.
And we tell them, you're not really a good candidate for that because what you really need is a facelift. And people don't always want to hear that. And we usually tell these same people, you will go somewhere else to one of these doctors who has one tool in their toolbox, which is maybe FaceTite. And they'll tell you, oh, yeah, you're an excellent candidate for it.
This is definitely going to happen. Mm-hmm. We see this all the time.
Yep. So they go get the FaceTite.
Oh, yeah, for sure. You should definitely do the FaceTite.
Yeah, like you don't need a facelift. Are you crazy? You're 55. You don't need a facelift.
And then you're looking at this and it's like, a lot less money involved with the FaceTite. You do it in the office, 45 minutes on the neck. And the doctor said is to be
it's
just like a
same.
neck lift.
Like, I don't need
totally
a facelift.
The same. Yeah.
Mm-hmm. No, and then we see them a year later and they're like, wow, that was really didn't give me what I wanted. And yeah, like now they really need a facelift. Now they spent all this money on something that did nothing or didn't do what they thought it would.
I try to convince myself in those situations that the doctors are still ethical, but maybe they're persuaded by the technologies they have. But our office, I'm a expert in many different technologies. I teach it to other doctors. So if all places, our office should be the place where we steer people toward technologies, and we absolutely don't do that. So if we're trying to do the right thing, then I shouldn't alleviate this other physician by pushing these patients, you don't know the whole scenario, into those like unnecessary procedures. It's just inappropriate. And if you have any sense when you're in there that they're pushing you towards something and it really doesn't feel right, then like just don't do it, even if maybe they're correct.
Well, at least get another opinion.
Maybe the golden rule should be if it's just relying on a technology, it's probably not going to ultimately end up where you want it to end up if you're trying to use that as an alternative to surgery.
We say that in our episode where we talk about technology in plastic surgery or skin tightening technologies. We say it in that one. To be fair to these doctors, and we'll talk more about this in the ethics and ego part, are they unethical in telling you that FaceTite is that you're a candidate for it?
Yeah, no, that's the thing. Right. That's the gray area.
Right. It's an elective surgery. You're healthy enough for an elective procedure.
It'll probably make things a little bit better.
Yeah.
Yeah.
Even if it makes it worse, it doesn't mean you're not a candidate to have the procedure done.
Right. Because you're healthy. You have loose skin on your neck. Yeah. Maybe you have some fat on the neck. And FaceTite, that's like the check marks for FaceTite.
Being a candidate does not mean you have a good outcome. So
yeah,
that's a good thing to ask. So something else, do you have realistic expectations?
Does you? This is a deep episode, man.
Well, the dark side.
I'm going to have to step out. Yeah. Does your surgeon have realistic expectations? You know how many times that I ask Amy questions that I already know the answer? How many times? about my plan for surgeries, it's because I trust her. I know she's going to tell me the truth, and I can talk, I'm human. I can talk myself into things. And I always want honesty from my staff, my surgical team, the fellows that rotate with me, anyone in my life that respects me. I want full honesty because especially when you're a surgeon, you're going to be type A, you're going to be alpha, male or female. You're going to be very confident if you're good, and that you can do pretty much anything you want, right? You're capable technically of doing it, but is it the right decision? Are you considering the patient themselves? Have you listened to the patient? And Amy, especially, but my entire staff is so helpful in that sense. And it does help me kind of bring in my expectations, bring in the plan, and try to isolate what's probably best for this patient overall.
Yeah. Well, and if your doctor is saying this is the expectation, you can expect a 20% improvement, but in your mind, you're like, oh no, it'll be more. Well, are your expectations realistic? Probably not if your doctor is honest and ethical and telling you the truth. So if you think, even though they're telling you you are, let's go back to the FaceTime example, like they'll tell you like you would see a moderate change. It might even make some areas look worse because, the skin is going to be maybe more saggy without that fat to support it. And you're like, oh, no, I've seen the before and after pictures. I'm going to look like this 35-year-old who had it done. That's going to be me.
Well, that's the patient. That's
what I mean. Yeah. That's where you as the patient also need to have a realistic expectation.
Yeah, it's a two-way street.
It is. And that goes back to doctor's not your judge. Like you have to be involved in this joint decision making.
Yeah. When this business is such a funny business when you do it, when Amy and I do it. And, it took me a long time to realize, okay, wow, I'm really good at this stuff. I'm really technically talented. But then it took me even longer to realize that's really not the most important thing. Mm-hmm. The most important thing is to be able to communicate with patients exactly what you can and can't do and the expected outcome. If you do that and deliver on what you say, every patient will be happy, who's sane, who can make reasonable decisions.
Who also has that same expectation.
Right.
Yes.
And we're pretty good at ferreting out like who's really not thinking right. But if you say, I'm going to change something 20% and this is exactly how I expect it to be, and you can kind of deliver on that, the patients are universally happy. And that's what patients want. They want a dependable outcome, assuming that you can get within a range of what you said you could. Mm-hmm. And that makes, I think, the biggest difference.
Yeah. And one other thing that your doctor should definitely be providing some education on is knowing what to expect during recovery. And that's short-term and long-term. We are very open and honest with our patients that some of these things, they'll come in 3 weeks after surgery, like, oh, I still have some numbness here. Like, when do you think that's going to go away? I could say like, oh, soon. But I also say it could take up to a year, because I want people to have the expectation in their mind of what is realistic for the human body. Yeah. I mean, our bodies are incredible. We Sloverine all the time, like we recover, but there's also parts of that might be outside of what someone expects in their mind. So like the expectation might be that I'm not going to be like that. I'm going to be the person who had a tummy tuck and was like climbing a mountain the next day.
Yeah. Sometimes I feel a little bit bad because I love people like that in my real life. They're like so positive, but like you can't do that with surgery. You have to be really straightforward. It's not something you can like trick yourself into believing it's going to go great. You just have to be prepared and know what you're getting into.
Yeah. And if your doctor's telling you that like there is no recovery, well, that's another big red flag.
Yeah.
Like they're not the ones having to do the recovery, sure, but there is recovery.
So one last thing. So I talked about as a surgeon that non-surgeons tend to do treatments and stuff that they say is like this, so you could do Body Tight in the office and it's like a thigh lift. Even though I do Body Tight all the time, it's not like a thigh lift. Body Tight of the arms is not like a brachioplasty. Mm-hmm. Great episode, by the way, there. But it works the other way too. Surgeons themselves tend to say things that were, kind of elitist and saying, well, you can only do a deep plane facelift. This is the pinnacle of facelifting. And this is the only thing that you need. And I do this and I do it the best. And that in itself is not ethical. They're utilizing a procedure that not many people do and applying that to every person. And that's not surgery or good surgery or medicine also. Mm-hmm. So it's a two-way street on that. So I'm sure that if I was being honest with myself as a plastic surgeon, we can fall into the same trap that maybe dermatologists do and stuff like that, just in a different way. So instead of you getting that, fractionated CO2 laser on your face, you definitely need a facelift. Well, no, it's a gradation of how much change you want. And then you need to, get that information and make a decision that's right for you. Yeah. So,
and maybe you need both.
Most of the time you need both.
All right, we're going to get to the topic that Dr. Martin has been dreading, but it's not that scary. So ego. Ego is real in all humans. Like we are, to survive, we are inherently egotistical beings. We just are. I mean, we all have this grandiose sense of self, and that's what keeps us alive. And honestly, ego is not always bad. However, when it comes to decision-making with your surgeon, when it involves your life, there are some definite things you need to think about. Interestingly enough, when you look at these studies about decision-making, I'm going to read a quote from one study that says, first, that most patients want to be involved in decision-making. Patients perceive that the physician makes the decision more often than they prefer and perceive more involvement in the decision than objective assessment by an independent research. So basically, that's just saying that the patients would like more involvement. They perceive that the doctor is making the decision more often than they would like. In that same study, they asked doctors kind of how they felt about it. So a number of observational studies have shown low levels of patient involvement in daily clinic practice. Research on the barriers that hamper further implementation of these decision-making tactics has focused on the physician's perception of the decision-making process. It has been shown, for instance, that many physicians think that they already apply. They also feel that their patients either don't want to be involved in the decision-making process or are too sick or too emotional to be capable of participating meaningful in decision-making. And in some cases, exactly.
Yeah.
Like that's them saying like, oh, well, we already do that. Or they don't know. They're too sick. They're too emotional. Yeah. Right. And okay. Yeah. People come in here highly emotional. Like people cry in our office about how they feel about something on their body.
That happened to me yesterday.
Yeah. So do we take that and like, we got you now. You're too emotional to make a decision.
Yeah. Too emotional.
We're going to make it for you.
I don't have to talk about the risks or benefits. I don't have to. We'll just sign you up, take your money and just do your surgery. Yeah.
Yeah.
That's such BS.
Right. But this is a thing. And, these things do kind of feed into each other. Like my example in the beginning, that doctors are put on a pedestal for a good reason. I mean, there are professionals in our lives that we interact with that should be given an extra amount of importance in our decision-making, not being our decision maker.
Yeah. I agree with that. With expertise, right. Even
an auto mechanic, your pilot, right?
We use ourselves as the example. I have a ton of experience. Amy has a ton of experience in plastic surgery. Clearly, patients come in here wanting our opinion, and they want us to guide them, right? To be their Sherpa through this whole process. But
that's what we want to be.
Yes.
It's not our journey as much as theirs.
We want that too. Yeah. At the same time, their involvement is probably the most important part of that journey.
Right. For outcomes, for everything.
Yeah. And it makes a more bought-in patient. It makes happier patients. And it is a weird dynamic in this field. I go into the operating room, I'm fully normal people, and very confidently decide that I'm going to make their bodies better. Okay? They don't even have a disease. They just have life realities.
Or they just have life goals.
And I am absolutely confident that I'm going to knock it out of the park. And you want that in your surgeon, right? Mm-hmm. But that can cloud your judgment. This is getting very Star Warsy now. That can cloud your judgment in terms of that interaction. And it takes a long time in your career in this field to figure out that ultimately what the patient's experience is not as much of what you technically did or how you did it. It's really the communication you had with them beforehand and their experience through everything, not just the surgery and the immediate recovery, but the after recovery, and then for months afterwards. And then they come back and say, well, that wasn't that bad. I look so much better. You did exactly what you said you were going to do. Thank you so much. And that is, in a nutshell, defines good surgery. But that if I went through that whole process, or Amy did, and we really just interacted with them with ego, then they would never have that experience. And they would not feel invested. They would not feel empowered.
Yeah. And they might spend then the next 10 years. And that's always the saddest part, when we have somebody who has had maybe multiple surgeries with maybe the same surgeon because they keep wanting to get something fixed or changed or something, and they just never come to a place where they actually understand what the other person is getting at. And that's maybe not on nobody's fault. I'm not blaming the patient for that by any means. I mean, I always say, like, not every patient is a fit for us either. So if you're butting heads, with your surgeon, like, that's time to kind of, move on. I listed a few things that I think you should kind of ask yourself as the patient to help you understand whether or not you're interacting with ego only, or someone who really wants, who's an expert who wants you to succeed and have the best possible outcome. Is your surgeon asking you about your desired outcome and expectations?
Right.
Like that is key, because if they are not, if they're just telling you what your outcome and expectation should be, that's maybe a little bit of a red flag, because it doesn't really allow you to have any input. I mean, if your expectation is something that can't be done and you don't know that, and that happens, people's expectation in their mind is something that is not possible with any surgery.
The second one, if it sounds too good to be true, is really a red flag. Mm-hmm. And that's when someone's looking at you and like, your whole life's going to be different. I'm going to knock this out of the park. Everything's going to be on. You're going to be perfect.
Or let's just do this right now.
And maybe this provider, this surgeon, we're all egotistical. Maybe he or she has convinced themselves of such. It's just not true. Mm-hmm. And if those words, those perfect, this is like everything's gone, everything's perfect. That's just, and I'll say things that butt up against that. I'll say, this is going to be so much better. I'm so excited for you. But
this is going to be great.
This is going to be amazing. You're going to be transformed. Like, it's going to be you're going to go from one place to another. And this is going to be such an awesome experience. But I would never say that, something that's so solid in terms of the words I'm choosing, that everything's going to be on, everything's going to be perfect. And when you hear that, I mean, I think that you need to take a step back.
Yeah.
A little bit.
Or being pressured to do something when maybe you are in a highly emotional state. These are emotional things. When we talk about cosmetic procedures, it's about our body. It's about our perception of ourselves. And if you go to an office and you're kind of worked up about something that really bothers you, and they're trying to pressure you to do something right now, we can just do this right now.
Yeah. We'll give you 20% off. Just do it right at this moment.
That's a big red flag too.
Yeah, that's a red flag also. By the way, who takes advantage of all this stuff? The veterinarians. I love my dogs. Every time I go in there, they're trying to get me to do some stem cell therapy.
Right? Like if you loved your dog.
I know full well that none of this is going to make a difference. But I'm like, maybe I should do the stem cell therapy. Yeah.
The guilt, that's parent guilt right there. So does your surgeon and their office take time to answer your questions? If they do not have time to answer your questions, regardless of what those questions may be. A lot of times people say like, oh, sorry, like I'm probably your most problematic patient. I'm asking so many questions. I'm like, well, you have a high bar. Trust me. Like you will never, because there are people who do. I'm never going to tell someone, I would rather them ask than look on TikTok, because that's what they're going to do.
Right.
So ask. I tell people that ask as many questions as you want. Email me, text me, like ask me your questions, because I want to be the one to answer them, or Dr. Martin wants to be the one to answer them if it's about surgery, rather than Google. Like, do not Google a question that should be asked to your surgeon.
There's nothing wrong with Google, but you need to, the real discussion comes with the surgeon and the patient.
Yeah. So if you don't feel like you can get your questions answered, like that also is a big red flag. Let you ask this one, Dr.
Has
Martin.
your surgeon told you he or she will decide the best surgery outcome for you? Is this like Mad Men? What is this, like the 60s?
Exactly.
Yeah, it feels like that.
Yeah. This is not the way
Don
it
Draper,
works. Yeah. I'm going to decide. But we hear patients tell us this still all the time. I trusted them to do the right thing, or they said they would do this and I got this, and this is not patient blaming.
Can I say something about trust?
Yes.
This is the way I look at trust. Again, as a very egotistical.
Trust fall?
Yeah.
Come on, bring it in.
No way.
I catch you.
Don't freak me out.
I'll catch you so much.
I refuse. I'm not doing that. I'm not going to trust fall. Even though I think you could catch me because you're strong. You're like inordinately strong. Yeah. So this is the way I look at trust with patients. And I mean this. Again, as a very egotistical surgeon that's confident, I have to earn it. When I meet someone, my goal is to earn their trust, not to, impart it onto them, just saying that.
Or enforce your will.
Exactly. I want to earn it from you. I want to draw that in. I want you to believe in me. And the way you do that with trust is education, empowerment, all the things we've talked about today. And so if you're in a place and, again, being a confident person, that's great. You want your surgeon to be confident. Yeah, a little bit egotistical. Maybe there's some comments coming out of his or her mouth that are like, oh, wow, that was kind of a egotistical comment. Not the worst thing ever, but are they earning your trust? As opposed to just like saying, you have to trust me dogmatically. And that earning part really does come from them spending time with you and the office staff too. And by the way, surgeons are not perfect. So we surround ourselves with more perfect people. So if you go into an office and the surgeon's kind of a jerk, okay, but he's really good and you feel like he's invested in you, and the office staff are all jerks also, then don't go there because you're going to have a terrible experience. So Amy and I are like, we're like a weird married couple, even though we're not married. We work together, but like we balance each other out. Like her positives are my negatives and vice versa. And then we kind of meet in this middle area where it's like perfect, right? We come together. And that's what you want from your office that you go to, the place where you choose to do this elective surgery. Yeah. So earning the trust, I think, is really important.
Yeah, absolutely. And then following that up with, let's say, okay, your surgeon tells you that they are going to choose for you. Are you okay with that outcome? Are you okay with any outcome? That's a big question.
Yeah. I mean, breast aug, rhinoplasty, facelift.
Rhinoplasty. Oh, big one.
All these.
Are you okay with any nose?
No.
Was that in Spaceballs? We're going to give your daughter her old nose back?
Here we go with the Spaceballs.
Mm-hmm. Yeah. I mean, that's really what you need to ask yourself. So if you really feel like your doctor is your judge and decider, then are you okay with any outcome? Any? Are you okay waking up with no leg? Maybe they decided you didn't need it. I mean, that's extreme, but like, I'm not kidding. Like that, if you are going to say that, then you better be okay with literally any outcome. Any. Because that's what it would be. And that's not realistic. Like no one wants that. Your doctor doesn't want that. No ethical doctor wants to make your decision for you because that doesn't lead to good outcomes. It doesn't provide buy-in from the patient or from the patient's family or caretakers. Like nobody wants that.
It increases the doctor's liability. Just look at the lawsuit rates on situations like that.
Yeah. Well, just even without lawsuits, like let's take any type of litigation out of it. Like that's not why doctors get into this. They want to help people. They don't want to be people.
Yes. Thank you for saying that. So by and large, not everyone, like what is it? 3 out of 100 people are sociopaths. Right. And that's
Those
true.
It's true. Even in doctors.
Yep. But most people that go into medicine, doctors, PAs, nurse practitioners, nurses, scrub techs, anesthesiologists, they're well-intentioned.
Paramedics.
Yeah, they want to help people. That's why they choose that field. Hey, you make a good living, but you can actually help people. Mm-hmm. That's their reason they chose to make the sacrifice. And it's a sacrifice. Yeah. It's a lot of work. So I don't think that everyone or most people out there are just doing the wrong things. But when it involves money, when it involves scheduling, involves emotions and things that maybe are not absolutely necessary, like elective surgery for the way you look, then these things come into play. Mm-hmm. Now, I have to say one thing about ego. Ego is necessary too. There are times, and this has happened to me in the past year, where I have to take command and I have to take control of the situation for the patient purposes, especially for
confidence and ability is different than ego.
Right. But there are times where my ego benefits me. Mm-hmm. And in those situations where the proverbial poop is hitting the fan with something with patient care, and I step in very confidently and tell people basically to get out of my way. I'm going to take care of this. You're going to do this. You're going to do that. I'm not even going to have this discussion with you. You're doing all these things. That has to come from a place of ego and confidence. And so you need that. You need that. It is that weird balance of compassion and understanding and empathy mixed with this ego and confidence.
Yeah.
So you don't want to also go to a surgeon that's like, I just don't know.
Like, what do you think?
Yeah. What do you think? I'm so confused. I mean,
those surgeons exist.
They exist. Yep. So you want to, it's this Goldilocks area of confidence and understanding and empathy. And
ability. I put ability so high up on that list.
Yeah. And then if someone is really able, but maybe not as compassionate, but they're at the very least checking the boxes they have to in terms of education, discussion of the risk and benefits, getting your opinion, then yeah, go to them. I mean, you may not want to have dinner with them, but they're really talented in what they do.
And they've communicated with you appropriately.
Yeah. But I mean, it's like a weird dance back and forth. And life is too. It's very analogous to life. So you're always going back and forth from your ego to this area of acceptance, back to your ego in this area of acceptance. And it's kind of the same thing with surgery. The funny thing is you just have to perform. And, there's some times where I go into my ego because I'm like, I pump myself up in my head. When it's a hard case, I'm like, man, you're really good. You got this, and that's
it's like lifting heavy weights.
Yeah, it is. It is. Yeah. It's the same as lifting.
You gotta be your own hype man.
Yeah, I do. I hype myself up, and I do that with music. I surround myself with people that support my creativity. Nils is one of them. Amy is one of them, and that fulfills me. Especially in plastic surgery, which is a very artistic field. If you read any biographies about artists, they're mercurial people and they don't like to be around areas where they can't be creative, And so I do the same thing when it comes to surgery, but I do it with things that like kind of feed my ego as opposed to like, just playing jazz music or getting into a flow state. It's kind of like, okay, you got this. Let's go. And that's human nature. But overall, you got to find somebody with a little bit of that balance, and sometimes that balance can get out of whack.
Yeah, and that is why I put ethics at the. We talked about ethics on our first episode about the dark sides of plastic surgery, so I didn't want to just cover ethics by itself again. But ultimately, ethics become the problem when the ego gets too big. Then the ethics start to slide. So definitely listen to our first episode where we talk about what goes wrong when ethics fall apart with doctors or your medical providers. So, Dr. Martin, you said this at the beginning.
Oh, I did say this.
Yep.
And that's so crazy. I didn't even look at these slides, and it's right there. Empowerment and education. That's exactly what we're doing.
This is the reason we podcast.
Yeah.
That is literally the only reason. Like we aren't, we aren't a for-profit podcast.
Yeah, we're not self-promoting. Yeah. Unfortunately, we should.
Despite the fact that I would love for Element to sponsor us or Butcher Box. Who else can I shout out here?
Oh, there's so many. Wait. You should. I mean, you keep going. I'm gonna think about things I want to sponsor us. I would love for Butcher Box, but there's too big.
But the reason we podcast is because we want people to be educated, and that's just not our patients. I mean, I will tell you, the best patients we get are the ones that listen to our podcast because they're educated.
Oh yeah,
like they've heard these things, and I hope that goes the same. I hope that other doctors have patients walk into their office with their list of questions that they got from our podcast to ask them, and are like, "Wow, that person is super educated. Like that made my job easier." Like that's, empowerment is so key in these things. And it's scary. Walking into a surgeon's office can seem very intimidating and very scary. And we make our office very warm and welcoming, but not every office is like that. And we get that. So empowering yourself and educating yourself to make good decisions. And this goes for any doctor you're seeing. I mean, talk about scary doctors. I'm going to go back to the breast cancer example. Like there will be times in your life where you are faced with, life altering decisions with health.
Insurmountable odds.
For yourself, for a loved one.
Yeah.
I mean, talk about stress, like try being the medical decision maker for a loved one who is unconscious or something. I mean, then burden of that.
I mean, I went through it with my dad, and I'm probably as knowledgeable as anybody ever could be in the healthcare setting. And there was hard times of decision making, and I had to go back to that North Star. Where are we going? What is the goal of this? What is the outcome that I want for my dad or for my family member or for myself? And that involves some internal discussions.
And being educated about your options.
Right. And I did. I actually educated on myself on hospice, I mean, and me, it's a successful ego surgeon. I was like looking into hospice. Oh, this is interesting. So I do think that if anything comes out of people listening to us, and we have so many people that are regular listeners, and I love that, or new people that found us, or patients that are coming into our office, and we have so many of those lately. I just saw someone like that yesterday. She was interested in blepharoplasty. She goes, "I watched both episodes." She was like, "Yeah, you don't have to tell me about it." Like, can I give my spiel, please?
Ask us your questions. We're done.
Yeah. I feel like I'm inadequate here, but I think that the biggest part of that is you understanding, number one, who you are, the path you're on, what goals you've set for yourself, and how can you achieve those goals.
And that your doctor is not God.
And your doctor is not God.
Not your God or any other God.
Even though this doctor's not bad. I'm pretty good.
Still not your deity.
Pretty good. Can you show that? HBO? No. Yeah.
So
that's the last season.
Yeah, that's right.
Yeah. If you've made it this far in the podcast, for those who listen all the way to the end of the podcast, sometimes we do fun things at the end. And something came to my mind, Nils, get your mic handy because I'm going to ask you a question. So, Dr. Warren, you're talking about like good hype music. So what would your entering the octagon music be?
Oh, I can't. I mean, there's so many options.
What would yours be, Nils?
Oh, man. I would probably go back to some good late 80s, early 90s punk rock like Rancid, because they could really, they play their music so loud. It's hype music. And it's more me because I was never really a hip hop guy. I was more of a punk rocker. Yeah. So yeah, I mean, I could throw a few out there. Yep.
Old school punk. Dr. Warren?
I have so many.
You got to pick one. I mean, if you get multiple fights, you get to pick more than one. But just pick one.
A lot of it's hip hop related, but I'll just go. That's the song.
First one that comes to your mind.
First one that comes to my mind is the Imagine Dragons song. You said where I'm the captain of my ship and the air in my sails or something. Yep. I feel like that's very ego inflating.
First things first, I'm going to say all the thoughts inside my head.
Yeah, exactly.
Yeah.
Because you said that reminded me of you, so I would play that one.
Well, yes,
How about
because
you, Amy?
There was a time where you and I were having a conversation and you told me to stop. You're like, I'm going to say the words in my head. And so
that doesn't sound so hype.
No, but that
sounds like my Asperger's.
I sent you that song and I'm like, this is it. Like, this is you. You're the captain of your ship.
I'm the captain of the ship.
Mine would be Avenged Sevenfold, Hail to the King,
I
or
love that song.
Queen in my case, Hail to the Queen.
That's a good one. Yeah.
Just that beat at the beginning. Oh yeah, there's so many good hype songs.
You know, the problem with hype songs is that every song, like every day I'll listen to a song that kind of pumps me up, and then it's like I can't choose, you know, and it like even like 90s pop will pump me up, then hip hop, and then like definitely some more hard music I love, you know, so it's hard. I mean, there's so many different ones.
Well, that's why Entering the Octagon was the specific, you know, hype around that, because that's like getting you like, getting in the ring. Okay. Yep. Well, thank you everyone so much for listening. Leave your hype song below, because I'm really looking for new gym tunes. So shoot us a comment with your favorite hype song. If you have made it this far in the podcast and you would like to leave us a comment, we would love it. If you'd like to send me a text, I would love that. You can text me or call me and leave me a voicemail at 303-630-9038. You can also follow us on all social media at Beauty and Surgeon Podcast and at Jason Martin MD. We're also on TikTok, and we're starting a TikTok. So if you want to get some actual education on TikTok, follow us.
That's a lot of stress that we're going to make our TikToks educational, but
they are.
Okay.
They actually are. They're great. All right. Thank you everyone so much.
Thank you.